a global public health concern. WHO has already declared it as an emergency. The purpose of this webinar is to brush up our knowledge related to infection control and prevention with regard to management of COVID-19 patients. Today I am proposing to follow this outline. We'll be talking about coronavirus, the risk of COVID-19 among healthcare professionals, transmission of COVID-19 among healthcare personnel, protecting healthcare professionals from COVID-19 using standard precautions, respiratory and contact precautions. In case of accidental exposure, what is to be done by the healthcare professional, patient assessment and placement, and how to ensure that patient is isolated and barrier nursing is provided. In case if healthcare professional has a contact with the positive patient, then whom to contact for the services. And finally, I'll conclude with some take-home message. To start with, coronavirus belongs to a family of viruses that causes illness ranging from common cold to more severe diseases. A novel coronavirus, it's a new strain that has not been previously identified in human beings. There has been human-to-human transmission. Now the question arises, are healthcare professionals at risk? Yes, healthcare professionals can be at risk. They can be at risk of acquiring the infection through respiratory route and direct contact with infectious patients. How does COVID-19 spread? It is from human to human, from person to person via respiratory droplet infection. That is the primary mode of transmission, followed by close contact. And this close contact can occur while caring for a patient, including being within approximately 6 feet, that is 2 meters of a patient within COVID-19 for a prolonged period of time, having direct contact with infectious secretions such as sputum, serum, blood, and respiratory droplets of a patient with COVID-19. If close contact occurs while not wearing all the recommended personal protective equipment. Again, a very big question is there in front of us, how to protect ourselves as healthcare professionals. How can we protect ourselves from COVID-19? We have to follow the standard recommendations, which includes standard precautions, respiratory precautions, and contact precautions, so as to prevent infection spread from patients to the healthcare personnel. Let's see what the standard precautions are. We all are familiar with the standard precautions. These are the set of interventions carried out by healthcare professionals while taking care of infected patient. Healthcare workers caring for patients under investigations or confirmed cases should implement standard infection control precautions, which include observing basic hygiene, use of personal protective equipment, respiratory etiquettes, maintaining environmental cleaning and disinfection, biomedical waste management, and finally, safe handling of dead bodies. So let us see one by one. So we start with hand hygiene. We all know that hand hygiene is one of the most simplest and cost-effective method of controlling the spread of infection. Hand hygiene can be performed using soap and water or alcohol-based hand rub. We should perform hand hygiene with alcohol-based hand rub or soap and water before and after all patients' contact with potentially infectious material, and before putting on and upon removal of personal protective equipment, including gloves. Remember, whenever our hands are visibly soiled, we need to wash with soap and water, not with the alcohol rub. So hand hygiene should be performed immediately after contact with the respiratory secretions and as and when you feel that you have touched the patient or the patient's belongings, which act as fomites. The second important component of standard precautions is referring to the use of personal protective equipment. Healthcare workers, they are involved in direct patient care. They should make use of the following PPE, that is the gowns, gloves, medical mask, eye protection, including goggles or face shield. Selection of personal protective equipment should be done very carefully considering the nature of activities we are involved in. For example, we are performing aerosolized procedures where the aerosols are likely to get generated. For example, endotracheal suctioning, while giving bag and mask ventilation, while providing non-invasive ventilation, or during bronchoscopy when we are assisting. As nurses, when we are assisting for bronchoscopic procedures, there we have to make use of the personal protective equipment, and then we have to also perform hand hygiene before putting on and after taking off PPE. Discard PPE in appropriate waste container after use. So use of personal protective equipment is decided depending upon whether you are involved in direct patient care or you are there as an ancillary staff, what type of procedure you are doing, which type of setting you are working in. For example, if you are working in the emergency department, ICU or ward, there you have to make use of particulate respirator like N95. While in screening areas or in the OPD, one can still manage with the 3-layer surgical mask. There are number of steps involved while donning and doffing the personal protective equipment. So there are 9 steps involved in wearing the personal protective equipment, while 19 steps are involved in removal of personal protective equipment. So one has to be very, very careful while donning as well as doffing the PPE. In between, hand hygiene is recommended between the 2 steps, like when you are removing your mask and between removal of goggles or gowns or gloves, it is recommended to maintain the hand hygiene. Use of double gloves is recommended when you are in contact with COVID-19 patients. Then there are transmission-based precautions to be observed. They are mainly of 2 types, respiratory precautions and contact precautions. Respiratory precautions, let us discuss in detail how we can ensure the respiratory precautions. Wear a medical mask while entering a room where the patient suspected or confirmed of being infected with Corona-19 are admitted. Use a particulate respirator like N95, gloves and gowns, aprons when performing aerosolized generating procedures such as tracheal intubation, non-invasive ventilation, tracheostomy, cardiopulmonary resuscitation, manual ventilation before intubation, and while assisting for bronchoscopy. Environmental cleaning and disinfection is considered to be an integral part of the standard precautions. We have to emphasize on routine cleaning and disinfection procedures as appropriate in the healthcare settings. Only the intensity and frequency is to be increased. In the areas like laundry, food services, we have to manage the laundry, food services and utensil in accordance with routine procedures. In environmental cleaning, the person whosoever is involved in the process of environment cleaning should ensure that personal protective equipments are on. Cleaning agents and disinfectants like 1% sodium hypochlorite solution can be prepared. Usually we have 5% sodium hypochlorite solution available. This can be reduced to the strength of 1% by diluting 200 ml of sodium hypochlorite with 800 ml of water. The solution should be prepared fresh. if you are using a long-standing solution, it is likely to lose its potency. So ensure that the solution which is prepared for the cleaning purposes, freshly prepared, and it should be covered. Otherwise, there would be escape of chlorine gas and therefore making the sodium hypochlorite solution ineffective. Leave the solution for a contact time of at least 10 minutes. There are certain surfaces where the use of bleaching powder or the bleaching agent is not recommended, such as metals. So in those surface areas, alcohol, that is either isopropyl alcohol 70% or ethyl alcohol 70% can be used to wipe down the surfaces. There are some cleaning guidelines. First of all, we have to ensure that the area where the cleaning is going to take place is sealed off. So seal off the areas where the confirmed case has visited before carrying out cleaning and disinfection. Mopping the floor with routinely available deodorizing agents like phenyl or 1% hypochlorite disinfectant solution can be used. Wipe down all accessible surfaces of wall as well as the blinds with bleach solution. Discard cleaning items into biohazard bags. Disinfect buckets. The buckets which were used for the cleaning purpose should be disinfected by soaking in 1% hypochlorite or bleach solution. Dispose of the waste generated as a result of cleaning into biohazard bags. Cleaning staff should be attired in suitable personal protective equipment. This is something very essential and mandatory.